When assisting a bedridden client with repositioning, the HHA's first priority should be A. To move the client quickly to avoid strain. B. To maintain proper body alignment of the client. C. To finish the task before other duties. D. To place pillows only under the client's head. Answer: B. Maintaining correct body alignment prevents complications such as contractures, pressure ulcers, and respiratory difficulties. Speed and convenience should never override safety and proper technique. A client with Parkinson's disease is having difficulty feeding themselves. The HHA should A. Take over completely and feed the client quickly. B. Provide adaptive utensils and encourage independence. C. Remove food to avoid messes. D. Offer only liquid meals. Answer: B. HHA should promote independence by using adaptive equipment like weighted utensils, allowing the client to maintain dignity while receiving support. When providing care for a diabetic client, the HHA should report immediately if the client A. Refuses to eat dessert. B. Has a blood sugar reading of 250 mg per deciliter. C. Drinks more water than usual. D. Chooses to exercise lightly. Answer: B. A blood sugar level of 250 mg per deciliter is significantly high and requires prompt reporting to prevent hyperglycemia-related complications. A client who is on oxygen becomes short of breath while walking. The HHA's correct action is to A. Increase the oxygen flow rate immediately. B. Encourage the client to sit and rest while monitoring breathing. C. Remove the oxygen device for comfort. D. Leave to call the nurse without staying by the client. Answer: B. Oxygen flow rates should not be adjusted by HHAs. The correct response is to ensure client safety, allow rest, and notify the nurse. Which action by the HHA best supports infection control in the home setting? A. Washing hands before and after client care. B. Wearing gloves all day, regardless of task. C. Using the same towel for drying hands and dishes. D. Only cleaning visible dirt from surfaces. Answer: A. Proper hand hygiene is the most effective infection control measure. Gloves are task-specific, and cross-contamination must be avoided. A home health aide notices new bruises on a client's arms and legs. The HHA should A. Ignore them unless the client complains of pain. B. Ask the family privately if they caused the bruises. C. Report the findings objectively to the supervisor. D. Apply ointment to the bruises immediately. Answer: C. Unexplained bruises may indicate abuse or a medical issue. HHAs must document and report to their supervisor without making assumptions. A client with dementia insists it is morning when it is evening. The HHA should A. Argue and correct the client forcefully. B. Agree and reinforce the client's confusion. C. Redirect the conversation gently to another topic. D. Leave the room to avoid conflict. Answer: C. Redirection avoids confrontation while maintaining calm, supportive communication with clients experiencing cognitive decline. Before assisting a client to ambulate with a walker, the HHA should first A. Place the walker out of reach. B. Check that the client's footwear is secure and non-slip. C. Encourage the client to walk barefoot for stability. D. Push the walker ahead quickly for practice. Answer: B. Proper footwear ensures safety and prevents falls. The walker should remain within reach and used at the client's pace. If a client begins choking while eating, the HHA's immediate action should be to A. Offer a drink of water. B. Perform abdominal thrusts if the client cannot speak or breathe. C. Call the nurse first before taking action. D. Wait to see if the client recovers alone. Answer, B. Abdominal thrusts, Heimlich maneuver, are essential if the airway is fully blocked. Quick action can save the client's life. Which of the following demonstrates respecting a client's privacy? A. Entering the bathroom without knocking. B. Discussing the client's condition with neighbors. C. Closing doors and curtains before providing personal care. D. Reading the client's mail to stay informed. Answer, C. Preserving privacy by closing doors/curtains protects the client's dignity and confidentiality. A client prescribed a low-sodium diet requests potato chips. The HHA should A. Allow the client unlimited snacks. B. Refuse harshly and remove all food choices. C. Encourage healthier alternatives while respecting preferences. D. Ignore the diet restrictions to avoid conflict. Answer, C. The HHA should support dietary restrictions while promoting choice and dignity, balancing health needs with respect. When measuring a client's radial pulse, the HHA should A. Count for 15 seconds and multiply by 4. B. Use the thumb for accurate pressure. C. Count for 1 full minute if irregular. D. Estimate the number by observation. Answer, C. For irregular rhythms, the full 60-second count is essential for accuracy. Thumbs should not be used as they have their own pulse. A client with limited mobility is at highest risk for A. Respiratory infections. B. Pressure ulcers. C. Hair loss. D. Nearsightedness. Answer, B. Immobility reduces circulation and skin integrity, making pressure ulcers a serious risk without regular repositioning. The HHA observes that a client refuses medication repeatedly. The HHA should A. Hide the medication in food without consent. B. Respectfully document and report the refusal. C. Argue with the client until they take it. D. Throw away the medication discreetly. Answer, B. HHAs cannot force or conceal medication. They must report refusals to the nurse for appropriate follow-up. A client begins to complain of sudden chest pain. The HHA's priority is to A. Give the client water to calm them. B. Assist the client to lie down and call emergency help. C. Massage the chest area. D. Wait to see if it improves. Answer, B. Sudden chest pain may signal a heart attack. Immediate rest and emergency notification are critical. Which action best prevents falls in the home environment? A. Keeping floors clutter-free and dry. B. Allowing loose rugs for comfort. C. Storing items high so clients stretch. D. Encouraging clients to walk in socks only. Answer, A. Fall prevention begins with hazard-free, dry walking surfaces. Rugs, clutter, and slippery socks increase risk. If a client's urine appears dark and concentrated, the HHA should A. Document and encourage fluid intake. B. Ignore unless the client complains. C. Add sugar to fluids for energy. D. Dispose of the urine without reporting. Answer, A. Dark urine may indicate dehydration. HHAs encourage fluids and report changes to supervisors for evaluation. A home health aide assisting a hospice client should focus primarily on A. Curing the illness. B. Providing comfort and emotional support. C. Performing only physical tasks. D. Avoiding communication with family. Answer, B. Hospice care prioritizes comfort, dignity, and emotional support during end-of-life care. A client suddenly becomes confused and disoriented. The HHA's best response is to A. Restrain the client to prevent wandering. B. Reassure calmly and notify the nurse immediately. C. Leave the client alone until they settle. D. Argue with the client about reality. Answer B. Sudden confusion may indicate delirium or medical emergency. Calm reassurance and reporting are essential. When assisting with perineal care, the HHA should A. Wash from back to front. B. Wash from front to back. C. Use the same cloth for all areas. D. Skip washing if the client is tired. Answer B. Washing from front to back prevents bacteria from the anal area from contaminating the urinary tract, reducing infection risk.